Hi, my name is Colleen Beener, and I'll be doing the FMLA webinar today for GPACT. I've had gastroparesis for the past 15 years, and I've been a volunteer with GPACT for the past 10. My background is in human resource management with an emphasis on benefits and government programs. So, what can the Family Medical Leave Act do for you? First of all, what is the Family Medical Leave Act? The Family Medical Leave Act provides up to 12 weeks of unpaid job-protected leave annually for certain individuals who suffer from a serious health condition or who care for a spouse, parent, or child with a serious health condition. In order to be eligible for this protection, you must work for a covered employer. Employers must have at least 50 employees. You must work at a location where the employee has at least 50 employees within 75 miles of your work site. You must have worked for your employer for at least 12 months. It doesn't have to be consecutive, but you cannot have a break in service that lasted more than 7 years. You must have worked for your employer for at least 1,250 hours in the 12 months prior to your leave. That works out to an average of 24 hours a week over the course of a year. You may take FMLA leave to care for your spouse, your child, or your parent who has a serious health condition, or you may take FMLA leave because you have a serious health condition. Serious health conditions include any condition requiring an overnight stay in a hospital or medical care facility, conditions that incapacitate the patient for more than 3 consecutive days and has ongoing treatments, chronic conditions that cause occasional periods of incapacitation and require treatment at least twice a year, pregnancy, maternal and paternal leave, and the birth, adoption, or foster placement of a child. So what can the FMLA do for you? Well, it can give you up to 12 weeks of protected leave within a 12-month period of time. FMLA leave is unpaid, but you may choose to use accrued sick, vacation, and/or personal time off to receive payment for all or part of your leave. In addition, your employer is able to require that you use all paid time off during your leave. During your leave, your employer is required to continue your health insurance. You are still required to make any employee contribution required. If you return to work before you exhaust your leave, your employer must return you to the same job or one that's nearly identical, and time off under the FMLA may not be held against you in employment decisions such as hiring, promotions, or discipline. Now, it can be taken as a single block of time of 12 weeks, or it can be taken intermittently. People with digestive tract diseases also often use FMLA as intermittent leave. You're entitled to receive up to 12 weeks of leave equivalent to your regularly scheduled work week. For example, if you're a full-time employee who works 40 hours a week, your intermittent FMLA leave would be equal to 40 hours times 12, or 480 hours. If you're a part-time employee who works 24 hours per week, your intermittent FMLA leave would be equal to 24 hours times 12, or 288 hours. Now, your employer can choose to track FMLA one of two ways, either using the calendar year or using a rolling year. If using a calendar year, you get 12 weeks of leave between January and December. That means you could apply for leave in August, use your 12 weeks, then apply again in January for another 12 weeks. If your employer uses a rolling year, your 12 months begins on the first day you take covered leave. So if your first FMLA leave is on 5/6/2012, your year would run until 5/5/2013. To request FMLA leave, you must give your employer appropriate notice. For pregnancy or a scheduled surgery, you must give 30 days advance notice if possible. When you need to take FMLA unexpectedly, you must tell your employer as soon as you can, usually within 1 day, and you must continue to follow your employer's regular call-in procedures. You do not specifically have to ask for FMLA leave the first time you take it, but you must give your employer enough information to make them aware that your leave may be covered under the FMLA. To be safe, you should request from your employer the necessary forms that they use to request FMLA protection. You may be required to submit medical certification that details the need for your covered leave. You don't have to tell your employer your diagnosis, but you must give them enough information so they know that your leave may be protected. Your employer has some responsibilities. They have to notify you within 5 days of your first leave request if you are eligible for FMLA leave. At the same time, they have to give you notice of your rights and responsibilities, including how they are going to track your FMLA, either by calendar or rolling year. Whether you are required to provide medical certification. If required, it must be submitted within 15 days. Your right to use paid leave, or whether or not you are required to use accrued paid leave. Your right to maintain your health benefits, what it's going to cost you, and how you should pay them. If you're not getting a paycheck, it will not be payroll deducted, so you need to make arrangements to make those payments. Your right to return to your job at the end of your protected leave. You must know your employer-specific leave policy, as you need to comply with both that policy and the FMLA. If medical certification is requested by your employer, you only have 15 days to get it. You're responsible for the cost of obtaining this certification from your healthcare provider, and these days many of them will charge you a fee for filling out paperwork. If you fail to provide this certification within the specified time frame, your request for leave may be denied. The medical certification must include the following information: contact information for the healthcare provider, when the health condition began, how long the condition is expected to last, appropriate medical facts such as symptoms, hospitalization, doctor visits, if you are unable to work or if it is your family member that's in need of care, and whether you need your leave to be continuous or intermittent. Like I said earlier, you can usually get a form from your Human Resources office that your provider can fill out, and that way you won't have to make sure that all of this information is captured in a letter. Your employer has the right to request a second opinion, or even a third opinion if the first two differ, but they are responsible for covering the cost. If you're on leave for an extended period of time, you may be required to provide an updated certification. If you return to work within the 12 weeks, your employer is required to return you to the same job you left or one that is nearly identical. If you are not returned to the same job, the new position must offer the same or substantially similar duties, responsibilities, and status. It must include the same general level of skill, effort, responsibility, and authority. It must offer identical pay, including premium pay, overtime, and bonus opportunities. It must offer identical benefits: health, life, disability, pension, paid time off, etc. And it must offer the same general work schedule and be at the same or a nearby location. Now, some states have enacted laws that give you more benefits under the FMLA. For example, Maine. If you have 15 or more employees for a private employer or 25 or more for a city or town employer, you are covered under FMLA. In Oregon, it's 25 or more employees. In Rhode Island, it's 30 more employees for public employers. Vermont is 15 or more employees. District of Columbia is 20 or more employees. And there are also different laws for who is covered under the FMLA. Like we said earlier, federal FMLA only allows caregivers to care for a spouse, a child, or a parent. Some states have enacted more generous laws. Excuse me. In California, you are covered for a domestic partner or a domestic partner's child. In Connecticut, a civil union partner and a parent-in-law. Hawaii, grandparent, parent-in-law, grandparent-in-law, or employee's reciprocal beneficiary. Maine, domestic partner and domestic partner's child plus his siblings. New Jersey, civil union partner and child of civil union partner, parent-in-law, step-parent. Oregon, domestic partner, grandparent, grandchild, parent-in-law. Rhode Island, domestic partners of state employees and parent-in-law. Vermont, civil union partner, parent-in-law. Wisconsin, parent-in-law. District of Columbia, anyone related to the worker by blood, legal custody, or marriage, a person with whom the employee lives and has a committed relationship, a child who lives with the employee and for whom the employee permanently assumes and discharges parental responsibility. There are certain employee groups that have special rules or circumstances. These include key employees, teachers, flight attendants, and flight crew. So the rules and the laws may be different for those groups. For more information on these groups, please refer to the U.S. Department of Labor's Wage and Hour Division website. If you think your rights under the FMLA have been violated or you have questions, you can contact the Wage and Hour Division at 1-866-487-9243. You will be directed to the WHD office closest to you for assistance. Source of this information came from the Employee Guide to the Family and Medical Leave Act, Wage and Hour 1596, August 2012, and the Employee Rights and Responsibilities under the Family and Medical Leave Act, WHD Publication 1420, revised February 2013. If you have any questions on the Family Medical Leave Act and how it pertains to you, please send your questions to contact@gpact.org. Thanks for participating.